So hello, my name is Fred Saad. I'm professor and chairman of urology at the University of Montreal in Montreal, Canada. So briefly, the ACIS study is a randomized controlled study of patients with metastatic castration-resistant prostate cancer previously untreated, and almost 1,000 patients were randomized to receive abiraterone alone versus abiraterone plus apalutamide to see if we can improve outcomes over the standard of care of abiraterone. So the trial was positive. It showed an improvement in radiographic progression-free survival of about 7 months in the combination versus abiraterone alone arm. And in terms of subgroups, patients over 75 seemed to gain the most amount of benefit with improvements in radiographic progression-free survival, but also statistically significant improvement in overall survival that was improved by about 7 months in those patients that were over 75. Also, in the visceral metastatic subgroup, there was improvements in radiographic progression-free survival and also about a 5-month improvement in overall survival. So, in summary, this trial shows that we can improve outcomes over abiraterone alone. Okay, so the question of whether we still need basic androgen deprivation therapy, if we're going to be combining two very effective hormonally based new generation therapies, such as abiraterone and apalutamide, and the answer is really unknown. All the clinical trials kept androgen deprivation therapy continued throughout the study, so we really don't know if it would be enough to be combining these new generation hormonal therapies without the underlying castration that was required in all the clinical trials. This is something that probably needs to be answered eventually, but my personal belief is for now, we should always continue basic ADT when we add these novel hormonal therapies. So obviously there's been a lot of progress for patients with metastatic hormone-sensitive disease. We've shown that we can improve their outcomes by intensifying therapy, either with chemotherapy or with novel hormonal therapy, such as apalutamide, abiraterone, and enzalutamide. Unfortunately, the fact is, around the world, there are still many patients, if not the majority of patients, that still go with nothing beyond ADT in the metastatic hormone sensitive setting. So unfortunately, we're still seeing on a regular basis patients who have metastatic castration resistant disease that haven't been pre-exposed to any of these novel hormonal therapies. And so there still is a need to do better for the metastatic castration resistant patient. Now, the reasons are multiple. There are economic reasons why many of these patients don't get hormonal intensification in the hormone-sensitive state. Even in rich countries like Canada and the US, the minority of patients are actually getting treatment intensification. And so there still is a need to do better in patients with metastatic castration-resistant disease. Now, in the patients who could have access to them, many of these patients, whether they're a little bit too elderly or didn't or refused intensification, these patients are often well enough in the metastatic castration resistant setting to be getting these therapies and want to remain active at home and to delay progression, especially if they're elderly and there was never any intent of giving them chemotherapy. So I think this is possibly an effective form of helping patients that are elderly. And the ACIS study actually showed that we significantly improve survival in patients over 75 who get this combination therapy over abiraterone alone. So the utility of this combination HSPC is attractive. We've shown that when we add drugs like apalutamide or abiraterone to patients over ADT when they're metastatic hormone sensitive, that we improve outcomes. it would still need to be shown if combining two hormonally based therapies plus ADT will lead to better outcomes overall. So this is still a clinical trial question, something that I would not do outside of a clinical trial. But there are efforts to look at this triplet combination over the doublet that seems to improve significantly progression and overall survival.